The fun begins, Jerry.
Okay.
All right, we're here today with Jerry, and Jerry's about to start his treatment with Dr. Davis. So, Jerry, tell me about those knees. What's been going on?
The left knee is sore daily, constantly. Varies from the front one day to the back and down the calf on another day, but they never happen at the same time.
Right.
And it's just restricting me from walking my dog and doing my own walk. And
How long has it been like this?
I had a hip replacement last April, end of April. As soon as that hip replacement was done, I had no pain, no pain pills or anything with that. It was so easy. But immediately it went to the left knee.
So after you had the hip replacement done, then the knee starts hurting.
Yeah, and I've had RA for 21 years.
Wow.
So I'm assuming it's kind of a
It's moved
process.
on to a new hot
Right,
spot.
So there's only 2 knees left.
Because you've had 2 hip replacements, right? Holy.
They were very simple and easy.
Right.
I know knees are not supposed to be that way.
So tell me, how active are you, Jerry?
Used to. Now I probably walk I would walk 2 miles a day normally.
Right.
But in the last 5 years, since I had this hip and then this hip, I used to run 4 to 6 miles a day.
Wow.
And I played racquetball at 5 o'clock until Y every day. And then I would.
So you were very, very active. 4 to 6 miles of running a day?
I didn't, yes, I didn't run on Sundays though.
Okay.
But I was
Still.
also a traveler. I flew over 3 million miles in my business career. So
Wow.
a lot of times I'd take my running gear,
Sure.
San Jose, Sacramento, San Francisco, Denver, Salt Lake, places like that. I'd take my running gear, Pittsburgh, or, Atlanta, places like that. And I didn't take my running gear.
Right.
I wanted to get back in one piece.
Right.
So it was, it was kind of that. But I've always been active.
Right. So we got to keep you active.
I'd like to get back part of it. I know I can't go far being the age I am.
All
I
right.
can do better.
So what was your discomfort level today in that knee? 0 being no discomfort, 10 being unbearable.
4 or 5.
You're about a 4 or 5 today? Okay.
Now when I stand up, there'll be a sharp little pain in 2 spots.
Uh-huh.
It goes right away.
Okay. So is it like when you just do a movement like that, you get like that stabbing pain, but then it goes away?
When I get it, I think probably be a taxing movement, like taking a step up to,
Mm-hmm.
But I don't like taking steps with the right foot, initiating each step on each tread going up to
Right.
the door or something. like
Right.
that. I want to use this one. That's why I want to get some of this back, so get back to normality.
Absolutely. Absolutely. All right, Jerry, I'm going to have you stand up for me.
Okay.
Was there any discomfort when you did that?
Yes, ma'am.
Okay, and point to where it was, those 2 spots right there. Okay. All right, I'm going to have you.
Get a picture. I'm Jerry. This is my friend.
Okay.
Jackie.
Hi, Jackie.
This is Jackie.
All
Do
right.
your thing.
Go ahead, hon. You want me to move?
I want to see your progress.
Oh, I just started day 1.
Oh,
He hasn't started yet.
this is my man.
So I said,
When I go to everybody else and they tell me this, that, I know where to come to get fixed.
good for you.
All right, Jerry, I'm going to have you take 2 steps forward.
And then
All right, feet shoulder length apart, arms straight out in front of you, and I'm going to have you squat down. Whoa, that's pretty low. Any discomfort there?
oh yeah, same place.
Same place?
Here and here.
Okay, all right. Now I'm going to have you go up and down the stairs.
Without a handrail or with
I want you to hold on to the handrail.
Okay.
Yes. All right, and now back up the stairs.
That's a little bit.
So it's a little more difficult going up those stairs
It is. It is the same place.
in the same place. All right, Jerry, you ready to get started?
I am.
All
Just went
right.
to the bathroom and washed my hands.
Walter, feeling good?
Yes.
Hey, Charity. Charity's getting better.
I am.
Masterpiece, as long as it works, right?
Oh, check it out. Dr. Davis is working on somebody here.
Look at that.
Oh, let's take a look at what's going on over here.
All right, ladies, take those away.
The fun begins, Jerry.
Okay.
It's nice for people to see that it's not that bad, right? Okay. So you're gonna do that breathing that we just went over.
Okay. Start now?
I'll tell you when to start. So you'll take a deep breath, and you're gonna, like if I had a rope underneath you, you're just gonna pull your knee up, like pull it up
As high as you can go, Jerry.
as high as you can go, with the strength of just your leg.
Oh, without the rope.
So you're engaging
Gotcha.
these muscles here, and you're pulling straight up. Okay.
So, and that's part of the breathing?
With the breathe. So it'd be like this: deep breath, hold. 1, 2, 3, 4, 5, 6, 7. Just like that. I'm gonna give you a little resistance
Okay.
so we can get a nice tonal change in what's happening with your knee, okay? Take a nice deep breath and pull your knee up. 1, 2,
Blow it out,
you
Jerry.
got it. 3, 4, keep going. 5, 6, 7, good. Breath, pull your knee up. Go. 1, 2, 3, there you go. 4, 5, 6, 7. You're doing fine. Just keep the strength there. Reach down again. Take a nice deep breath. Pull up. 1, 2, 3, 4, 5, 6, 7. Reach down now. Right away, you want to reach to the floor.
Okay.
Feel different?
Yes, ma'am.
Yes, ma'am. What changes have you noticed?
The knee didn't hurt getting up, but just all over I feel.
Just walking there, it felt like it
More
easier,
relaxed-
smoother,
More relaxed or something.
more relaxed.
More,
All
more
right.
ease or something.
All right, let's put your shoes on and go outside. All right, we're back with Jerry. Jerry's finished his first treatment with Dr. Davis. Stand up for us, Jerry. All right, 2 steps forward. Feet shoulder length apart, arms out. How low can you go?
That's about it.
Your squat's pretty darn good. All right, and we're going to go up and down the stairs, okay, Jerry?
Holding the rim. Right?
Yes.
Okay. Just that front part of the left knee, but I'm supposed to go work that out.
All right, so what changes have you noticed?
I noticed a little more limber in the bottom half of my body. Still
All
have
right.
that little nuisance pain on the front of the knee that I came with. But,
Therapies will definitely help with that, that's for sure.
but everything else.
You happy with today's progress?
Yeah, oh yes.
All right, let's get you in on some therapies.